Okay, welcome everyone to the BC Goat Association Johnes, the Disease and Testing Small Ruminant webinar. I'm Zoe, I'm a director of the BC Goat Association, and Dr. Glenna McGregor will be presenting this webinar. Hold on, can we get it to move here? Oh, come on, there we go. All right, so we did some survey results and we've got quite a few goat people, mainly goat people, a couple of sheep people, and some from the interior and the island and lower mainland. And just a little bit of housekeeping for the webinar. This webinar is recorded and it will be available for public viewing. We request that you keep your mute on at all times and your video off. And if you have a question, if you could just put that in the chat area. And yeah, it just makes it a little easier for bandwidth. And just a little bit about the BC Goat Association and some benefits if you're not a member already. We have government representation for the goat industry in BC, and we provide a newsletter. We try to get it out every month. And obviously webinars, which you're in today, and we really promote education on management of goats. And really excited to welcome Dr. Glenna McGregor again. She's from the BC Animal Health Centre. She's one of the top BC veterinary pathologists there. And she also works at the Western College of Veterinary Medicine. And she's extremely passionate about education on small ruminants. So we're very fortunate to have Dr. Glenna McGregor present this webinar. Right, so over to you, Glenna, and excited to see the webinar.
All right, thanks, Zoe, and many thanks to Zoe for organizing this. Zoe and I were talking, and I think both of us have been getting a lot of questions on Johnes disease in the last few weeks for a few different reasons. And so we thought, oh, let's just save time and do a bit of a webinar and sort of just a basic overview of Johnes disease, things we can do to control Johnes disease, things you can do to prevent introduction, and then testing, because the testing is really complicated, and the interpretation of the test results is really complicated. So sort of an overview of what testing can do and what the limitations are, because there certainly are quite significant limitations in the tests we currently have for Johnes disease. So before I get started, if I could just see a share of hands or emoji of your choice, maybe a crying emoji. How many people here know, if you're willing to share, that you have a Johnes positive animal in your flock or herd?
If you're not sure how to do that, you can also just put that in the chat as well.
Now, how many people here have heard of, if you have a little hand emoji here at the bottom, have you heard of Johnes disease, or is this sort of a beginning, like I haven't heard of it before? All right, so it looks like a smattering of people have heard of it. A smattering are probably not willing to admit that they've heard of it. And then some people, it looks like in the chat that it's all pretty new to them. So as usual with these webinars, there's a pretty wide range of knowledge and expertise. So if you've lost me completely, or if I've lost you completely, just put a message in the chat and Zoe will let me know, hopefully. And we'll go back and go over bits where I've lost you. And we'll move on from that. Yeah, so it looks like a couple people are admitting to having it. Lots of you do, if our prevalence is anything to go with. And then a lot of people aren't admitting to it or don't have it, which is great, and want to keep it that way, because ideally keeping it out is going to be a lot easier than controlling it. So now I'm going to try and share my screen, which after this year you'd think I'd be a master at, but not always. Go. All right, is that working, Zoe? You nod? Perfect. All right, so I work at the Animal Health Centre, which is the only fully accredited veterinary diagnostic lab in British Columbia, one of 4 in Canada. And this is where you'll probably get most of your Johnes testing done. If you're from the Lower Mainland, or even if you've driven through the Lower Mainland, as you're driving on Highway 1 from Hope to Vancouver, right side of the highway, just in East Abbotsford, you'll see this red barn-like building. That's the Animal Health Centre. Most of you probably know it, but phone number there, or if you just Google Vet Diagnostic Lab BC, it'll pop up first thing, or at least with my Google algorithm, it pops up first thing. And we do a wide variety of testing and a wide variety of animals. So I think I spoke about that at the last webinar for the Goat Association. But if you do have an animal diagnostic related question, just let us know, pop us an email or give us a call. We see everything from, had a crocodile this week, to dogs, cats, sheep, goats, cattle, chickens, fish. So any animal that you've got a disease question with, let us know and we'll do our best to help. So Johne's disease. So it sounds like some people are pretty new to Johne's disease. It's a bacterial intestinal disease of sheep and goats, cattle, and other ruminants, so animals sort of the 4-chambered stomachs. It is a tricky disease because it's actually really quite hard to see until it's quite advanced. So often all you'll see is just a thin animal, usually a thin animal that's eating pretty well. Sometimes they'll have some clumping of feces or diarrhea, but that's not as common in sheep and goats. Cattle have a very typical, it's called a hose pipe diarrhea because it just shoots right out of them. But sheep and goats are more designed for desert environments. And so they are quite equipped to absorb a lot of fluid from their colon. So they just don't show diarrhea until it's really, really bad. So you often won't see the diarrhea in sheep and goats. In sheep, often you'll see it, they call it, in Australia anyway, they call it the tail of the mob. So just the sheep that when they're being herded that are at the tail end are often the ones with Johne's disease, just because it does cause some weakness as well. And we'll go through over how it does that in more details. So it's also called, the scientific word for it is paratuberculosis. And that's because it's a bacteria that's quite closely related to the cause of tuberculosis, different bacterium, but closely related. So para means beside tuberculosis, so beside tuberculosis. It's caused by infection with the bacterium, Mycobacterium avium paratuberculosis, or MAP, which for the bacteriology nerds out there is a gram-positive acid-fast bacterial rod. It's a chronic progressive intestinal disease of ruminants, so that's cattle, sheep, goats, deer, and was first described in 1875 by Heinrich Johne, who is a German veterinary pathologist, hence the name Johne's disease. It is present everywhere in the world where there are cattle, sheep, goats, and other ruminants. So I think Antarctica is probably the only continent that doesn't have Johne's disease because there aren't any cattle or sheep there. We don't really know the prevalence in BC. We haven't done that testing. In Canada, in dairy cattle, about 66% of farms in Western Canada are positive for Johne's disease, 55% in Ontario, 24% in Quebec, and 47% in Atlantic Canada. That's a bit lower than the United States prevalence. The USDA estimates that it's about 80% of dairy herds in the US are positive for Johne's disease. So very, very common. Sheep and goats, we really have no idea what's going on in sheep and goats. In Ontario and dairy goats, it's estimated about an 83% prevalence. And in dairy sheep, an estimated 67% prevalence. It is probably significantly lower in our meat goats and meat sheep, but that testing hasn't been done. The only place where meat goats or sheep have been tested is in Missouri, where it's found in about 55% of boar goat herds. There is some thought that the prevalence is increasing. All right, so how does Johne's work? So Johne's is an interesting disease because it really occurs over a very, very slow period of time. It's got a really long incubation period. So what happens first is the animal ingests the bacteria. It's typically when they ingest fecal material, so that could be udders that are contaminated with feces, fecal material and water, water that's been contaminated with fecal material, feed that's been contaminated with fecal material. And typically animals that are less than 1 year of age are most susceptible, particularly our really neonatal animals. They are the most susceptible for Johne's disease infection. So that means that most of the bacteria that are ingested will go into the wall of the intestine, whereas older animals, it typically is cleared. Though older animals can get infected. Typically when they're infected as older animals, they're less likely to get disease and it's a much more prolonged clinical course and they will shed less bacteria. So it's really those young animals that we worry about being exposed most. Bacteria then enters the cells of the intestine and very slowly replicates. Some animals will clear infection. We don't really know how many these are. Estimates are that about 70% of sheep will clear infection. Estimates are that about 80 to 85% of cattle will clear the infection. But again, we don't really know because we don't really know who's been affected. So that's based on experimental studies where they've given animals a certain quantity of Johne's disease. So it doesn't really replicate perfectly natural infection. So it enters the cells in the intestine and it really slowly replicates. It's a very slow growing bacteria. So it takes years for it to grow to a point where it causes a problem for the animal. So over years, most commonly 2 to 5 years, can be as little as 1 year, particularly in goats, can be as many as 14 years in some cases, but typically over 2 to 5 years, it replicates in the intestine, and in the intestine, it replicates within inflammatory cells. And so I'll show a picture of this later, but you just get a buildup of inflammatory cells that are filled with bacteria, and that prevents nutrients from being absorbed, hence the weight loss and the diarrhea. Once the bacteria is numerous enough, it'll trigger an antibody response. This means that we can detect that the animal is positive on a blood test. But until that point, it will not trigger an antibody response until the bacteria is numerous enough, typically 2 to 5 years after infection. And it will start to be shed in the feces, and then they'll test positive on our fecal PCR test, which I'll talk about in more detail later. At this point, bacteria are shed in the feces in very large numbers. So this animal may not have any clinical signs at this point. They may look completely normal, but they're shedding billions and billions of bacteria into the feces and then into the environment where it can be eaten by other animals. It can also be shed in milk and colostrum. And the bacteria do not replicate in the environment, but they're really, really hardy, and they'll last for months to years in the environment where they can be eaten by susceptible animals. So clinical signs, the biggest one is weight loss, typically in the face of a good appetite in an older animal. So we almost never see clinical signs in an animal less than a year of age. So if you're having weight loss in animals that are younger than a year, look for a different diagnosis. It's not going to be Johne's disease. Very rarely we can see it in sort of 9 to 12-month-old goats, but that's pretty uncommon. Weakness, so again, they'll be the slower animals. They'll be the ones lagging behind when you're herding your sheep. Sometimes you can see anemia, so they'll look quite pale. Sometimes you can see edema, so it really can mimic bottle jaw in some cases. Sometimes you'll see diarrhea. Almost all cattle, dairy cattle, will have diarrhea, but less than 20% of sheep will have diarrhea. Same story with goats. And again, that's because they are more adapted to a desert environment. So they're just much more efficient at resorbing liquid from their intestinal tract than our cattle. So of course, it's not the only disease that causes these clinical signs. They're all pretty non-specific. So other causes of similar clinical signs, most of you can probably think of several. So caseous lymphadenitis would be one. Gastrointestinal parasitism would be one, especially those animals where they have anemia, so they'll be really pale, and edema that really mimics bottle jaw in some cases. So if you've got a bottle jaw that's just not responding, Johne's, especially in an older animal, Johne's is something to think about. Poor dentition, cancer, basically any cause of chronic inflammation will cause this collection of clinical signs. Probably the most characteristic is an animal that's losing weight but has a good appetite, because the other causes will often decrease their appetite a bit. But that does mean you have an animal that you're observing quite closely to note. So the next slide is a picture. It's a picture of an intestine. So if you're at all squeamish, look away. But this here is a sheep that's infected with Johne's disease that I saw a couple weeks ago in the lab. If any of you have looked at your sheep's intestines, they should be really thin, like almost like you could almost you can see your fingernail through them. Like they're quite thin. And here, this is an animal with Johne's disease, and this intestine is just very, very thickened. And it sort of has a bumpy cobblestone appearance, which is really characteristic of Johne's disease. Microscopically, this is a normal sheep. This is just to get your eye in for a normal intestine in a sheep, because you probably don't look at that many. So the normal intestine, there are these little wavy villi. And then there's a large number of crypts in it. That's how your intestine has enough surface area to absorb your food. So this is just a close-up on the normal. Again, these long wavy villi are really important. And then these crypts, which they're the base of the villi, but it's hard to get like a section that's perfect. And then this is the lamina propria. It doesn't have a ton of cells in it. The crypts are all quite close together. The villi are quite close together. This is that sheep that I showed you that did have Johne's disease. Again, the villi are almost completely gone. So those wavy fingers are almost completely gone. The intestine is super thick. And there's just sort of this messy looking stuff that's expanding. So we'll go back here. This is the muscle here, and it should be just the crypts are right there. Here's the muscle down here. Here are crypts up here. So there's just a ton of this messy looking stuff in between the muscle layer and the crypts. And if we go in closer, we see that that's a ton of inflammatory cells called macrophages. So that's what these big guys are. Macrophages' job is to eat things that are not supposed to be there. So what happens is they eat the Johnes disease bacteria, but the Johnes disease bacteria is really adapted to life inside a macrophage, and it can replicate very effectively inside the macrophage. It cannot replicate on its own. It has to be inside a cell to replicate. So we're just going to close up here. All of these really hard to see tiny blue dots, those are bacteria. This is an acid fast stain of a different case. Again, you can see the wavy fingers are gone, the villi are gone, so this intestine does not have very good nutrient absorptive capacity. And all of these purple cells, this is an acid fast stain, which stains the Johnes disease bacteria purple. All of these tiny purple dots are bacteria within macrophages in that intestinal tract. So here, just a close up here, just gazillions and gazillions of bacteria. And as your intestine regenerates, your entire intestinal tract pretty much regenerates itself every 3 to 5 days. These cells get sloughed into the feces. And so there's just billions of bacteria that are going into the feces every day from this animal. So the bacterium itself, Mycobacterium avium paratuberculosis, or MAP, friendlier name because it's really long. It can only replicate in cells. It's an obligate intracellular bacteria. It isn't able to absorb iron on its own, so it needs to be in a cell. So if it's in the environment, it doesn't replicate. It has to be in a cell, but it can last for a long time in the environment. It grows very, very slowly. We used to only be able to culture to detect it, and it would take more than 3 months because it just grows so slowly before you can even see it in culture. Now we've got some newer technologies that allow us to detect it much more quickly. It thrives and replicates inside macrophages, which is a type of white blood cell. So those are your normal defenses, and it just hijacks your normal defenses, kind of like the Trojan horse. And then it persists, but does not replicate in the environment for long periods of time. So at least a year in some situations. And we'll go through different, how long does it last in water? How long does it last in soil, and that kind of thing. So it is in the Mycobacterium family, which has a lot of bacteria we do not like. So it's in the M. avium complex, somewhat related to the Mycobacterium leprae, causes leprosy, Mycobacterium tuberculosis. So one thing all of these bacteria have in common is they are very difficult to treat. So there are some drugs that are effective against the mycobacterium, but they are very expensive. Most of them are not allowed for use in livestock because they are absolutely essential for use against leprosy and tuberculosis in people. And they have a high rate of resistance development. So we can't really risk that rate of resistance developing by using them widespread in livestock. They're also extraordinarily expensive. So who gets it? So ruminants, so those are cattle, sheep, goats, deer, bison. Camelids can get it, so those are llamas, alpacas. Occasionally rabbits and hares can get disease from it. And then there's infrequent reports of infection, but not disease in a number of other species. And we don't really know the role that these species play in spreading Johnes disease from farm to farm. It's possible, but by and large, your big risk is bringing in a ruminant or a camelid. So cattle, sheep, goat, llama, alpaca onto your farm and having them live on your farm if they've got Johnes disease. One vole going by isn't going to be a big deal. Sort of as you saw, there's a lot of bacteria. So you need to get infected by a pretty significant number of bacteria to have disease. In low numbers, the macrophages can kill it, but when you ingest it in high numbers, the macrophages can't kill it. So you really need quite substantial exposure. So one rat pooping on your farm isn't going to be a big deal, but it is a possible mode of transmission, but likely not clinically significant. So the big question is if humans can get Johnes disease. This is actually a really controversial topic and a really active area of research. We can definitely be infected, and it is assumed that every human basically is exposed to Johnes disease at low levels at some point. So be that in unpasteurized cheese, poorly cooked beef products, in our water supply, it's been found. So every human gets exposed to a low level of mycoplasma or MAP bacteria. But we don't really know if it causes disease in humans. There is a possible association with Crohn's disease, but it's quite controversial, and a number of people have devoted their lives to studying this. One point that is suggestive is the pathology is really similar. So On the left, that's an intestine from a human with, this is a formalized one, so it looks a bit funky, but an intestine of a human with Crohn's disease. And you can see it looks really quite similar to that intestine of the sheep. And then on the right's the histology. And again, you see these giant macrophages, this really macrophage rich inflammation in the intestine. So it is quite similar from a pathology standpoint. MAP DNA is detected in 46 to 100% of blood and biopsies of people with Crohn's disease. So most biopsies of people with Crohn's disease will have the DNA present, but you typically don't see the bacteria like you do in sheep and goats. So it's really an open question whether it's there as a cause of disease or whether a diseased large intestine just accumulates more of these bacteria that normally just pass on through. But it is 7 times more common in biopsies from people with Crohn's disease than in biopsies from people with ulcerative colitis, which is another inflammatory condition, which suggests that maybe it isn't just an inflammatory condition, makes you more prone to it. And also 7 times more common than in normal control biopsies. On the maybe it doesn't cause Crohn's disease side, exposure in the human population is very, very high, and yet only a very small percentage of people have Crohn's. And it could be that there's genetic linkage, that you need both the bacteria and a genetic predisposition. But at this point, we just don't know. And on the other, and another point that maybe is like, oh, maybe it doesn't, and is relevant for us in this virtual room, occupations that allow for high exposure of mycobacteria may be impaired tuberculosis, as in dairy farmers, goat farmers, sheep farmers, veterinarians. They do not show a higher incidence of Crohn's disease in the general population. So the risk of exposure doesn't seem to correlate to disease. So it might cause Crohn's disease. We really don't know, but you will hear that. There are 2 main strains, and honestly, it doesn't really matter because all species can be infected with each. They tend to cluster with the different species, but sheep can get the cattle strain. Oops, sorry, my light goes out if I don't move properly. Cattle can get the sheep strain sometimes. So there's back and forth. It doesn't really matter. For a while, we thought there was an intermediate goat strain, but that is actually when they did further DNA analysis, it's a subset of the sheep strain. So cattle strain mostly affects cattle and goats. Sheep strain mostly affects sheep, but it occasionally causes infection in goats and cattle. Much more common for sheep to have the cattle strain than for cattle or goats to have the sheep strain, but it still happens if they're in quite close contact. So this is a really complicated slide, sort of talking about what happens when an animal eats it. So here we have a calf. This is a calf slide. Most of the work has been done in dairy cattle. It's completely applicable to sheep and goats. So the calf, kid, or lamb eats the bacteria. It goes into their intestine through a cell called the M cell, which is a cell that's responsible for sampling your environment and letting your immune system know if there's a problem. The M cell delivers it straight into the macrophage. A macrophage, that's what its job is. It's to eat things that the M cell presents to it. But in this case, the macrophage can't eat it. If it's in low enough numbers, or if there's some sort of immune variant, we aren't really sure what happens. Sometimes it can clear it and you get a cure or a lifelong latent infection. So that's an infection that they've got low-grade infection their whole lives, but they never show disease and they never shed bacteria in their feces in meaningful numbers. Or you can have a cure. We think that's about 70% of sheep, about 80 to 85% of cattle, but we aren't really sure. And then the other way is it can go into the macrophage and then it just starts replicates in the intestine, and then starts to be shed into the feces. And then the cow starts to show sheep, goat starts to show clinical signs, and the cycle continues. So it is kind of an iceberg type of disease. So we might have a few animals that are clinically diseased. You're going to have a lot more that are subclinically diseased. So they would test positive, but you'd look at them and they'd look completely normal. And then we have a bunch of animals that look completely normal and may or may not show up positive on our test. So the vast majority won't show up positive on our test, but they may be infected and may start to shed bacteria at any time. And those are the ones that are really hard to manage because they're going to come back negative on your tests. So you're not going to know, but then they're going to start shedding at some point, and you're not going to know exactly when they're going to start to shed. And so then you don't know that your environment is getting all contaminated from these shedding animals. And that's why repeat testing is actually really, really important with this disease. In sheep, Sometimes the blood test will be negative before so they'll shed bacteria before the blood test turns positive. So sometimes the feces test is more sensitive in sheep, but also sometimes we have ones that test positive on the blood test and are negative on the fecal test. So it isn't quite as simple as this makes it seem. So in terms of routes of infection, ingestion is by far the most common. So most common it's from ingesting something that's been contaminated by feces. So either injecting fecal contaminated udder is a really bad one. Food or water contaminated with feces. Water, there's increasing evidence, and we'll talk about this in a minute, but there's increasing evidence that water plays actually a pretty big role. You can get it in milk or colostrum. So 2 out of 70, in one study, 2 out of 76 infected ewes did have DNA from MAP in the milk and colostrum. That study didn't look at how much bacteria was in there. So the clinical significance of the milk and colostrum spread isn't fully understood, especially in sheep and goats. In cattle, it plays a fairly significant role. Intrauterine infections do happen, and they have been reported in cattle, goat, sheep, and deer. So in cattle, about 1/4 to 1/3 of ones who have clinical Johne's disease. So those are cattle that are thin, they have diarrhea, they're testing positive. Their fetuses will be positive. About 10% of cows, so those are animals that look perfectly healthy, but if you tested them, they'd be positive for Johne's disease. They'll have spread in uterine. Sheep, it's been much less studied, about 40% of, well, 2 out of 5, so it's a really small sample size, but in the same realm as cows. So ones that are thin and test positive had fetuses that tested positive for Johne's disease, and what's 1 out of, what's that, 2%? Ones with subclinical, so they tested positive but looked perfectly healthy, had fetuses that had Johne's disease. So by that's spelled wrong. So by far the most common route of introduction is bringing in an infected animal. I know there's a lot of concern about other routes of introduction. You know, are you bringing it in if you're getting hay from a dairy farm? Are you bringing it in, you know, in runoff, that kind of thing? And those are really valid concerns, but you can cut down on probably 99.9% of your risk by not being really careful not to bring in an infected animal. So it's that wolf in sheep's clothing that you're going to bring in that has Johne's disease. So guidelines for bringing in new animals, and I do, this is really important, so I touch on it twice. So ideally you want to buy from flocks or herds that you know are Johne's free. And that is when they've had several, and you can never know when a flock is completely Johne's free. It's so common in the environment that you can never be 100% certain. But the closest you can get is at least 3 annual full flock. So every animal in the flock that's over a year of age, because it's useless testing in animals less than a year of age. The test will be a negative whether or not they're infected. But full flock, so tested every animal that is over a year, and they've all been negative for 3 years in a row. That's your best assurance that that flock is free of Johne's disease. Ideally, you want to buy from flocks or herd that have a good veterinary support and are run by someone who has fairly strong Johne's disease knowledge, and who has a management plan. If you're going to buy young stock, you want to make sure that you're buying it from a dam who has a negative Johne's test, because we don't really see uterine transmission, so transmission when the lamb is in the uterus, unless that animal is testing positive. So if you have a negative test, and the animal's been taken away from the environment at birth, we can be pretty confident that that animal is Johne's negative. So the country that has probably one of the best Johne's control programs is New Zealand, Australia, and they have a really quite robust protocol that's run by the government to assure that a flock is Johne's negative, to sort of provide that buyer assurance. And so they have these three levels for both sheep and goats, quite similar. So 1 negative flock, they sort of give you a moderate level. If you have 2 negative tests of either the full flock or a representative sample, if they have a very large flock, you get high assurance. And then the best is if you have those three negative samples a year apart for the whole flock. And there it is, compliant with a flock management plan, which is run by a government veterinarian with extensive training in Johne's disease. They're quite ahead of us in terms of Johne's disease control for government programs. But it is a good model to follow for like, okay, how do I know this flock is Johne's disease free? So here's sort of the environment movement of Johne's disease is a really hot area of research, and it's quite complicated. Again, far and away, it's those animals that are shedding bacteria. That is how the bacteria is getting into your environment in the first place. So those are really the important ones to control. And again, they can be shedding bacteria and look completely normal. And they can be shedding bacteria intermittently, so they'll test negative. But every now and again, they'll be shedding a little bit of bacteria. Typically, once they're shedding significant amounts of bacteria, they are positive. So that's why regular testing is quite important, to catch them when they convert from not shedding, test negative, to they're starting to shed. Oops, sorry. So it gets into the environment, and it lasts in the environment for a super long time. Herbivores maybe move it around a little bit. So those are hares, rabbits are quite susceptible. Wild carnivores maybe move it around a little bit. They don't get disease, but they can carry the bacteria. Interestingly, amoeba, it can replicate in amoeba. And so that's becoming increasingly obvious that that's playing a fairly significant role, especially around riparian areas. So fencing off those riparian areas can really help prevent the spread of Johne's disease, and also preventing bacteria from feces from getting into those amoeba. So not having animals defecating near your water sources. The role of slurry and waste spreading on fields is pretty unknown. It is a potential, and I'll talk about this in a little bit, but it is a potential route of exposure. But the clinical significance seems to be quite minor. And we'll talk about that in more detail later. And it has a lot to do with when you spread, and how long it's been in a slurry pit, that kind of thing. So survival in water, and water is really emerging as a fairly significant source. So there is a quite similar bacterium in humans, Mycobacterium avian hominis suis, and it is almost exclusively waterborne spread. And we think more and more that Johne's water has a fairly significant role, because it can survive for a super duper long time in water. It survives for 17 months in water, depending on the pH, but at least a year in pretty much every water they've tested. So avoiding fecal contamination of water sources is going to be really, really important. It also rapidly forms biofilms, and those concentrate the bacteria and make it resistant to anything you try to do to disinfect it. So clean troughs regularly. The persistence is least on stainless steel, than plastic, galvanized steel, and concrete. So if you have a choice, a stainless steel waterer is a great way to go. It also can infect, as I talked about before, it can infect and replicate in free-living amoeba. So it's common in aquatic environments. So keeping young stock away from riparian areas, also keeping your older animals, because they're the ones shedding in their feces, away from riparian areas. So fencing off wetlands and feeding in a trough, or giving water in a trough, especially if you have a positive flock or herd, is a great way to decrease the amount of transmission in the animals. If you have a fully negative herd, you don't really need to worry about Johne's disease, because you know everyone's negative. They aren't going to be contaminating this area. There are other reasons to keep them away from wetlands, but Johne's isn't one of them if you're negative at the moment. Survival in soil and feces. So it survives less long in soil and feces than it does in water. Water is the big one where it just lasts forever. So about 90% is rendered non-viable within 2 to 3 months, but some will last for over a year. So ideally, if you say you're buying a new farm, the previous owner mentions that they had Johne's disease, or they had dairy cattle on that farm where you've got, your odds are pretty good they had Johne's disease. You want to try and keep your young animals off that contaminated pasture. A lot of your risk is going to be decreased in 3 months if you can keep them off for 3 months, if longer isn't practical, but ideally you want to keep them off that for longer than a year. It does have shorter survival times in soil. It has a high pH, or if lime has been applied recently. So say you're moving on a farm, you're like, it is just not practical to keep my young stock off of this pasture for 3 months to a year. You can try applying lime to decrease the amount of Johne's contamination in that area. Manure management. So survival in the manure pit, most of it is killed off in 5 to 7 days. So that's not an unreasonable amount of time for manure to stay in a manure pit. But then it remains stable for about 4 months at 15 degrees C. And then after that point, it's no longer detectable. So if you are going to fertilize with manure, and dairy manure is used as a very common fertilizer for forages, and it can be hard to find forages that haven't been fertilized with dairy manure. There are a lot of management things you can decrease the risk. And again, bringing in a positive animal just dwarfs any of these other risks. But don't apply manure to forages that calves or heifers or kids or lambs are going to be used during the grazing season. Put the manure on as soon as possible following harvest, so it has the longest period of time before you're harvesting the next crop of hay. So that's basically what the next point says too. So if it's a applied to fields that you're going to harvest for dry hay. Do it before any regrowth occurs, with a minimum of 30 days between manure application and harvest. Injecting it into the soil is thought to be lower risk, but it hasn't been thoroughly studied at this point. So composting and biodigesting manure, if it's done properly, will also kill MAP. So testing is a beast for Johne's disease. So fecal PCR, we can pool up to 5 animals. So I'll talk about what that means. So that's looking for the DNA of the bacteria in the feces. So false positives are extremely uncommon. So there's, what's that? 3 out of 1,000 positives could be a false positive from fecal PCR. But there are a ton of false negatives. So sensitivity is 4 to 76%. That means that anywhere from 96 to 24% of your negatives are actually false negatives. And that depends on the stage of disease. You're going to have a lot more. False negative is kind of the wrong word. It's just they aren't shedding enough bacteria for us to find it. If the bacteria is in the feces, we will find it very reliably. But if they aren't shedding, if the bacteria isn't numerous enough in the intestine for it to be in the feces yet, there's just nothing to detect in the feces. So if it's a younger animal, so say a year, you might pick up 4% of your infected animals. So that's again why repeated testing is really important. Serology, so that's a blood test looking for antibodies to the bacteria. It is cheaper, so that's one advantage. Again, very specific, so very few false positives. But again, we have problems with false negatives. So, and again, false negatives is kind of the wrong word, but it's an animal that hasn't had, the disease hasn't advanced enough for the animals to have antibodies. So if the antibodies are there, we can find them pretty reliably. But in the early stages of the disease, the antibodies aren't there yet. So again, especially in young animals, negatives doesn't mean negative. A negative could mean true negative, or it could be not positive yet. So especially if you have other animals in the flock that are herd that are positive, there's a significant chance that it's a not positive yet. The sensitivity, when you have a full flock, even if you're only detecting a small percentage, when you're testing the full flock, you can be a lot more confident on a flock level that that flock is negative if everyone is negative than on an individual animal. And that's why the full flock or herd testing is so important, especially if you're trying to decide when to buy an animal. And also why repeated testing, a history of repeated testing in a flock or herd that you're thinking of buying an animal from, why that's so important. So serology is a blood test looking at serum, looking for antibodies. It's cheaper because it's done, we have 100 well plates. So it's very quick. So this is sort of what it looks like. And that's our serology lab. So it is $10 plus tax per sample. Ideally, you need more than 2 milliliters of serum. An absolute minimum is 0.5 milliliters. So if you just can't get more than that, we can run the test. But if there's any problem with the test, we won't be able to rerun it. And it's just a lot slower because we have to be really careful because we only have so much. So ideally more than 2 milliliters. If 0.5 mils is all you can get, that's all you can get. We can make it work. If you do want to run other serologies at the same time, that's 0.5 milliliters for every serology you want to run as an absolute minimum. Serum should be separated off the same day it is taken. So as you can see here, it's an optical density test. So we look at how blue, so the number of antibodies, more antibodies, the bluer the serum in this, once the test is done, will look. So if the red blood cells lyse and release a red color, it really messes up our optical density. So that's why you need to remove the serum, ideally within about 12 hours of collection. So it can be frozen once the serum is separated. It can be frozen no problem and sent in whenever, pretty much indefinitely. We've got some that I think were frozen in 1974 and they performed fine. It isn't that useful, you want to use the information sooner, so you're probably not going to save it for that long, but freezing for however long is not a problem. When you're shipping, we want to keep the samples cool. And blood is a lot harder to ship than serum. It has to get to the lab within 12 hours of collection, or the red blood cells are going to start to break down as they decompose and release that red color. It needs to be kept cool, but it can never be frozen, because frozen red blood cells, they get ice crystals in them and they just break to bits and the red color is all released and that messes it up. Also excessive heat, because proteins, the red blood cells will burst when they get too hot and release that red color. So if you don't live particularly close to the lab, you're going to have to separate off the serum. So you can either do that by, wait for 30 to 60 minutes at room temperature, and the clot will sort of sink and you can peel off the top. Or if you want to get the maximum serum from that sample, spin it in a centrifuge, or have your vet spin it in a centrifuge. We do batch these tests. We have those 100 well plates, and so we try and do as many of the 100 as we can at a time to cut down on costs and cut down on time. So the turnaround time is anywhere from 1 to 7 days, whether you happen to come at a time when we're running the test that day, and that depends on what comes in. So if we only get one Johne's disease and it's been 7 days and we haven't gotten any more, which really never happens, you'll get it within 7 days, but typically it's shorter than that. So what we're using right now is the Paracheck 2. We are shortly going to be moving to a new VMDL ELISA, because this is a German test and it's been really.
Lena, can I just stop you? I had somebody here. They wanted you to repeat separate the serum, please.
Oh, sure. Yeah. So take your blood. You're going to take it in. So I've got the tubes at the top. You're going to take it in either a red top tube, or if you're going to centrifuge it in a serum separator, a tiger top tube. If you're going to centrifuge, or you can centrifuge a red top tube. You're going to let it sit for 30 to 60 minutes at room temperature. And as it sits, you'll notice that there's a clear part on top, or clear yellow part on top. That's the serum. And then sort of a clotted reddish part, which is the blood clot at the bottom. You're going to take off that clear yellow part as much as you can get without getting any of the red stuff. So you can just have it sit and separate off. That works fine. If you didn't get quite enough, you're going to get more serum if you spin it in a centrifuge. So you can centrifuge it and do the same thing, and then put that into a separate, typically a red top tube or an Eppendorf tube, sort of a plastic tube, and then send just the serum to the lab, either frozen if you're from quite a long way away and shipping's going to take quite some time, or just on an ice pack as well. Hopefully that answers questions. I don't have access to the chat, so hopefully that does. Yeah, so we are using the Paracheck 2 at the moment. We're going to switch to a very similar assay. We've done 1,000 tests of both, and they perform almost identically, just because right now it's quite difficult to get the test kits in for this one because it comes from Europe. So basically what we do is we put the serum goes into a well, and then we put some other antibodies to suck up antibodies that aren't the right ones we're looking for, but that can cross-react. So that cuts back on a large number of our false positives. So then the antibody binds to the tuberculosis antigen on the bottom, and then we put in a second antibody, which has a conjugate or a sort of an enzyme, and that enzyme changes the substrate, which we put in from clear to blue. So the more blue, the more antibody you have stuck to your plate. And then we put it in a spectrophotometer and measure how blue it is. So that's an optical density. So how blue is this? And then we do that compared to a control, a positive control and a negative control. And that's how you get your percent positivity. So quite a few people are over-interpreting percent positivity. This one is actually a really nice test because when animals are positive, they have a lot of antibodies. Animals that are negative have no antibodies. So there is quite a clear line. So anything over 15% positive is considered positive, but we don't have very many in that gray zone. So typically they're either like 80, they're like very positive, or they're not positive. We don't have a ton falling in that gray zone. There is a slightly different cutoff with the new test kit that we're bringing in for sheep and goats. But for now it's 15, and just don't overinterpret it. Like a 1% means nothing. If it's not over 15, it's very, there's a 99.7% chance that animal is negative at that time. So doesn't have the antibodies either because they are infected or because they don't have antibodies yet. PCR, so that stands for polymerase chain reaction. So we're all quite familiar with PCR tests now with COVID. So it is a DNA-based test. So it looks for the DNA of the bacteria. It tells us nothing about whether the bacteria is alive or not. But for this disease, that doesn't really matter. So cost-wise, you're looking at $35 plus tax per sample, but you can pool in groups of 5 or less. So that makes it, $7 per animal if you're going to pool it. The thing is, then that pool will be either positive or negative. So pooling is useful if you're trying to screen your herd or flock. it's not that useful if you're trying to figure out which individual animal is positive. So we can pool in 5 groups and then split out the pools once they're positive. So just make sure to indicate that very clearly on the submission form. So submit animals, like even if you want us to pool it, submit them separately, because there's actually quite precise measurements of how much from each sample. And we like to mix them, blend them completely, so we have like a really representative sample from each animal before we pool them. So submit them separately. Ideally submit them in some type of either Whirlpack bag or Ziploc bag. A lot of people are submitting in gloves, and the lab really hates that because they're just really futzy to deal with. And ideally, and I know it's hard, but try and have just poop in the bag. Like we get somewhere sort of like they took a handful of shavings and there's a few pellets in there. And again, it's just really futzy in the lab to separate out. And also wood can have PCR inhibitors, which increases our risk of a false negative. So try and separate out the poop from the shavings and the grass and the other stuff when you submit. And the lab staff would really, really appreciate that. 10 grams of feces per animal is ideal. An absolute minimum is 4 grams. The test itself takes 2 grams, but if there's a problem and we need to repeat, which isn't infrequent, we want at least 4 grams, but ideally get at least 10 grams. So that's about a golf ball size handful of feces. As clean as possible, not mixed with shaving, and in a proper container like a Ziploc or Whirlpack bag. I mean, we will do them if they're mixed with shavings and in a glove, but it's just a lot more work for the lab staff. So how PCR works, if you don't know, so basically it's a way of amplifying DNA. So you have a primer, so something that has the genetic code of that only Mycoplasma avium or Mycobacterium avium paratuberculosis has, and then it binds to something in your sample, and then it replicates until we can find it on a gel. So it looks for DNA. So if there is a bacteria, it's very sensitive. If there is even one bacterium in the feces tested, it will find it. But if they aren't shedding bacteria yet, it didn't go into that particular fecal pellet that you sent in, you'll get a negative. So in animals that are infected where it hasn't replicated to a high number of bacteria, we can get negatives in an animal that's infected. And that's more common in younger animals because they haven't had as much time to replicate the bacteria. Testing is complex. There are a lot of nuances. So ideally work with your veterinarian or give us a call to come up with a testing plan. Because depending on your management, it's a lot easier if someone knows exactly how your flock is managed, what the groups are like, what the goal is, to choose which test is the most appropriate, and interpret those results. So just because an animal tested negative at 1 year of age does not mean they're going to be negative forever. So again, repeat testing is essential. So both tests are more sensitive in animals with advanced disease. So if money is tight and you just want to see, do I have it? Pick the 10% of the herd or 10 animals that are oldest and thinnest, because they are going to be the most likely to be shedding bacteria and the most likely to have antibodies to the bacteria. No point in testing an animal less than 12 months of age. If you do submit an animal that's less than 12 months of age, we'll call you and recommend against testing. We will run it. I mean, we'll take your money if you want to spend it, but it is not going to be useful. So don't bother in an animal less than 12 months. So if you go on our website, so I was at the beginning, but if you just Google Animal Health Center, it's a fairly appalling government unuseful website, but at the bottom right-hand corner, you'll see submission forms. So send it in with a submission form. The red is required fields. So we won't test the sample unless those fields are filled in. So if they aren't filled in, we'll call you. So your name, farm name, address, species, Johne's disease, the age is really important, again, because if they're less than a year, we're going to recommend against testing. And under animals, tick off feces if you're sending in feces, tick off blood if you're sending in blood or serum. Oops, lights out again. And then sort of at the back, under, if you want the fecal test, put PCR. If you want us to pool it, just be really clear that you want it pooled. If you aren't clear, we'll phone you, but we prefer it if you just write it. So if you want it pooled, write pooled. And if you could fill, if you want to be clear which animals you want to pool, because it's, you want to pool ones, okay, I think these are going to be negative, then you'll get a negative pool, you don't have to deal with it. So pool the ones that you think are going to be negative together, pool the ones that you think are going to be positive together, because then you can break down that pool more cost effectively. So if you give us a list of how you want them pooled, that's also, going to be the best for you in terms of minimizing the number of pools you have to break down and minimizing your test costs, and also easiest for us because we don't know what your goats are. We don't know that Bluebell hangs out with Tinkerbell all the time, and so if one has it, the other probably has it. So just pick the pools for us, and you'll get a better outcome than if we just make up how to pool on our own, especially if you have a small little animals and you know sort of how they work dynamic wise. If you want it, so that molecular PCR was where you put that for Johne's testing. Really, if you write on this form anywhere Johne's disease testing, we'll figure it out. For serology, just tick off the Johne's disease blood box. If you have an animal that you've got thin and it's died and you want to figure out why, is it Johne's disease? Is it something else? You can also send in the whole carcass for a postmortem examination. So it is going to be a lot easier to prevent Johne's disease than to deal with it. Johne's is hard to deal with once you've got it in your herd or flock. So especially if you're just starting out and this is all new to you and you're just buying new animals, you want to try and buy as few animals as possible from as few different flocks or herds as possible. As much as possible, you want to buy from test negative flocks or herds. And the more negative whole herd or flock tests, the lower your risk. So ideally, at least 3 annual negative tests. That may not be possible. That may not be possible within your budget. And that's going to be a decision you're going to have to make. Do you want to be really careful about Johne's disease risk, or do you really like this kid and you're willing to accept the risk of Johne's disease? There's no one right way to choose an animal, but if you're concerned about Johne's disease risk, these are sort of points to keep in mind. Lambs or kids should be born to test negative dams, otherwise there is a chance they've been infected in the uterus. And if you're bringing an animal in of unknown status, quarantine it until it reaches at least that year of age, ideally older, and test with both a fecal PCR and a blood test. Because if we do both at once, we maximize our chance of finding it. Because a positive means something, a negative means we don't know what yet. It means either negative or not positive yet. So control, so if you do have it in your flock or herd, it's a tough nugget. It takes a lot of time and it takes a lot of money. So the reason it is so widespread in dairy cattle is it is considered financially impractical to control it in a herd that is positive. So you will spend more money trying to control it than you would save in burden of disease. And that's probably even more true for sheep and goats, where the animals have less individual value. So the test per animal value is more expensive. So it does require a thorough understanding of the disease, and a close working relationship with a veterinarian who's familiar with Johne's disease is really, really helpful, because they can see, even if I had Johne's disease, if I had a herd or flock, but I don't, because land prices here are insane. But if I did, I would have a veterinarian out to look, because you're just too close to it when it's your own flock or herd. And a veterinarian, even if they aren't super comfortable with sheep and goats, they're going to know a ton about infectious disease. And they're going to be able to see, okay, this is an area where you could quite easily make a change to decrease your risk of transmission that, if you're so close to it, you'd miss yourself. It generally takes years. Typically, they say minimum 6-year commitment if you want to get rid of Johne's in a flock or herd. So that's 6 years of committing to regular testing and then management steps that decrease the risk of transmission. So if you aren't in it for the long haul, or you're just going to be haphazard about it, probably don't even bother trying to control it. Just accept that you have Johne's in your flock. Do what you can, don't have feet on the ground, clean your waterers regularly, do what you can to minimize transmission, but don't be really diligent about it. Because if you're not really committed, it's going to be almost impossible to get rid of it completely. And it's certainly not an invalid choice just to live with Johne's disease. That's what most of our dairy herds in the province are doing. They live with Johne's disease because the cost of eradication and the time commitment of eradication isn't worth the benefit of having a Johne's disease flock or herd, for dairy cattle. So again, in many, the financial cost of eradication will exceed the cost of disease. It's a completely different story if you have purebred animals that are of very high value for breeding, because most people want breeding animals that are Johne's free. So that's a different economic metric there. But think about it. Just because you have the disease doesn't mean you have to eradicate it. It's not Ebola. You will have low levels of loss in your older animals, but it isn't a particularly serious disease for animal health in a flock or herd. So living within your flock or herd is a perfectly valid choice. So testing, again, I've talked about this a few times, test annually. Test positive animals will be culled or segregated. So this is if you want to eradicate it. So if you're choosing, I want to eradicate it, you're going to test annually, you're going to cull and segregate any positives, and you're going to carefully observe all year round for signs of Johne's disease. And when you see those signs of Johne's disease, you're going to test. And if it's positive, you're going to cull or segregate or sell, because other flocks, if someone has chosen to be Johne's positive and they want to buy cheap animals from you, that's, as long as, ethically, it's good to be clear about your Johne's status and to be clear if you're selling someone a Johne's positive animal. But if they, in full knowledge, want to buy a Johne's positive animal, that's fine. Also, if you're trying to control it, so this is if you're positive and you want to get rid of it, you want to prevent new infections in goat kids. So manure management is super important because that's where almost all of your bacteria is coming from. So clean kidding pens that are free of contamination. If you are having separate positives and negatives, have individual pens is ideal, but if you can't, test positive animals and test negative dams are kitted in separate pens. Avoid manure contamination of water sources. So having a trough style water system as opposed to having them drink straight from a wetland or a pond or a stream is going to be best. Cleaning the water troughs regularly with a special care to the slime at the bottom, the biofilm, and then dumping that biofilm not in an area where they're grazing. So a lot in the trough, almost all the bacteria is going to be concentrated in the slime at the bottom and around the sides, like through the algae slimy bit. So when you rinse that out, just put it down a drain somewhere. You can bleach it. That will, once the biofilm is gone, bleaching will get rid of the bacteria. You want to avoid ground feeding for a number of reasons. So ground feeding increases spread of a number of parasites and coccidia as well, but also Johne's disease, just because you don't want poop contaminating their food. So having raised feeders or some sort of system where you minimize poop in food is very helpful. As long as it's feasible, put off stocking contaminated pasture with your young animals. So 3 to 12 months, if feasible, and different people will have, depending where you are and what land prices are like and what your land is like, that'd be maybe more or less practical. So in goat kids, if a dam tests negative, but she might be positive, pull them and then feed pasteurized milk or colostrum. And that is a pain in the ass because pasteurizing milk, it gets all clumpy. And colostrum is very, very challenging to pasteurize without it getting really clumpy and weird. But pasteurization will get rid of this bacteria. So colostrum, they absolutely need colostrum. In an attempt to get rid of Johne's disease, do not skip colostrum. It's absolutely essential. But if you can feed colostrum from test negative animals, there are colostrum replacers out there. Wash and dry the udder before you collect the colostrum because a lot of the spread is from feces on the udder. Don't pool colostrum because that just maximizes your chance of getting it from a positive animal. And avoid using colostrum. Some goat herds will use dairy colostrum. Try and get it from a Johne's negative herd if you can. Pasteurizing colostrum, again, it gets all clumpy. It's not that useful. There are no vaccines available in Canada. There is one available in the US for dairy cattle, and a few Canadian herds use it on emergency drug release. But it's a bit of a nightmare vaccine, actually. There are large local reactions, and vaccinated animals will test positive for tuberculosis. So I had a herd when I was a real vet, practicing dairy vet. I had a herd that had really high Johne's, and I vaccinated them with mycopar, and then we got a giant granuloma, and they tested positive for tuberculosis, and the farm was quarantined for 6 weeks. It was a nightmare. And I wouldn't recommend it for sheep and goats. It has huge vaccine reactions, especially in goats. And also, if it's injected into a human, it causes a massive reaction. Australia and the UK have a vaccine that is licensed in sheep and goats, but I don't believe that's being used in Canada at all. But down the line, maybe there'll be a vaccine option. For further information, I cannot say enough good things about this website, Johnes.org, the Johnes Information Center at the University of Wisconsin-Madison. Just phenomenal information there. And with that, I will turn it over to Zoe, and if there's any questions.
Yes, thank you so much, Glenna. Yeah, we have 16 questions so far, so I'm going to run through the list. So the first one was from Lacey. Can an infected doe pass to their offspring, but the offspring come back negative on a fecal at a year of age, but maybe test positive later?
Absolutely. Yeah, it's pretty common. It's pretty common that they'll test negative at a year of age because the bacteria just hasn't replicated enough.
Okay.
So unfortunately, that's one of the real tricky wickets with this disease is they can test negative and then positive later.
Right. Okay. Christina had a question. Can it be spread by deer feces? Our goats are not near any other goats, but there are a lot of deer in the area.
Possibly, yes. We don't see very much Johne's disease in deer in BC. Most of our testing has been on the island though, so I can't speak for all of the province. So it is uncommon, but possible.
Okay. Where am I? Yeah, Allison, she had a question about what's the cost of testing an entire sheep flock? I think you did go over that testing a bit. I think it would depend on how many they had in the flock, because I don't think there's a price break.
There isn't, no, there's no bulk discount. So if you're using the blood test, it's $10 times however many animals you want to test. And if it's PCR, it's 35 times however many animals you want divided by 5 if you pool them.
Okay.
What's that? 7 by however many animals for the
Right.
for the fecal test. The fecal test is possibly slightly better, but it's also really annoying trying to collect feces from individual animals. It can be a bit of a collection nightmare, and blood can be easier.
Right. Okay, thank you. Sandy had a question. I have been told the best time to test is in a high stress time. Example, breeding season, kidding season, and to do a PCR test. Is this correct?
I don't think anyone knows. I don't think that study's ever been done with whether they shed more bacteria at times of stress. I'm not familiar with anything that says that.
2 seconds here. Sorry, I'm just gonna put a question here on the end there. Okay, so Clarissa, how do you get your water tested? And I'm assuming that's for if there's any MAP bacteria in it.
We can do PCR on water. You'd probably, it isn't, gets a bit diluted. So a negative doesn't necessarily mean a negative. If you want it, like the slime on the bottom of a water is going to be like a swab on the slime on the bottom of the water is going to be your most likely thing to get a positive if it's contaminated.
Okay. All right. And Tabitha, how long after an animal is exposed to MAP can you say it wasn't infected if they are testing negative?
Unfortunately, never. Typically, once they reach about 5, you can breathe quite a lot easier, but it has happened that they've gotten to be 14 and just suddenly tested positive. Okay. So never completely sure. After 5, you can be a bit happier about it.
Okay. And Clarissa again, what would cause inhibitors in the fecal tests?
We actually don't have that many problems with PCR inhibitors with this PCR. So there are some things in feces that inhibit a number of our PCRs. It doesn't seem to impact Johne's disease PCR that much. It depends what primer you're using. Wood is a bad one. If it's in wood shavings, can cause some problems. And we try and be really careful to pull all the blood off, but that can be a problem.
There, okay, I'm just going back again. And Lacey, can a baby goat get Johne's from an exposed farm but not be anywhere near the exposed animal?
Yeah, as long as that goat eats feces from that farm or bacteria, maybe it was spread by deer from the farm. So yeah, it definitely can.
Sorry, there we go. Megan, question, can you please explain in a bit more detail how it is similar related to TB or how it got the similar name? Thanks.
Yeah, so it's in the same genus as Mycobacterium tuberculosis, the bacteria that causes tuberculosis. And so it causes pretty similar stuff where it lives, tuberculosis bacteria, it lives in macrophage. The tuberculosis goes in your lungs, but it lives in macrophages and forms these large aggregates of macrophages in your lungs. It's similar because it lives in the environment for a super long time, and that it's really, really hard to kill with antibiotics. Tuberculosis is very tricky to treat. It doesn't cause tuberculosis, but it's in the same genus. So closely related on like a evolutionary tree.
Okay. And Lacey had another question. If a goat was tested by blood and had a low count, would she still be carrying it and then jump up to a high amount by blood?
So you're talking about the percent positivity?
I'm assuming.
That tends to go up over time. So sort of the longer you have the infection, the more antibodies you have. So yeah, not uncommon, well, either for it to go from a negative to a positive because it's suddenly its body has suddenly decided it needs to mount an immune response to this bacteria. And then also as they get older, they tend to get higher in their percent positivity. Yeah.
Okay. And Olin had a question. When screening the herd, what is the best practice for yearly annual testing, fecal PCR or a serology, Eliza?
That's going to depend a lot on what animals you want to test. So if you want to be absolutely most sure, you would do both. That can often be cost prohibitive. The PCR in sheep is slightly more sensitive. So fecal PCR would be a slightly better option to find it. But it also is a pain in the ass trying to collect feces from each goat individually, especially if you have a large herd. That's often not practical. And so then a blood test would be a better option for you. If you're testing younger animals, sometimes they'll turn positive on blood first. So that might be a better option for you. It really depends on your system. So very best would be to do both. Typically that's not financially practical. And then it really comes down to management. It's kind of a crapshoot, which is better. They're both pretty insensitive in animals that are younger and don't have clinical disease. They're both pretty good in animals that have disease. If you have an animal that's thin, that's where the fecal PCR is going to be a lot more likely to catch it than the blood test. So if they're thin, older animals, I'd for sure do fecal PCR if you can. Younger animals, whatever is easier to collect.
Okay, that's great. Victoria has a question. How long do you keep samples in the lab? If you need to test individually, but it was not indicated to do so if the pool was positive, would you need to resubmit samples again?
We keep samples for 3 months. It depends if there was enough. So there has to have been enough feces submitted from each animal for us to rerun that test. So that's often a problem we run into with pools. People just don't submit quite enough.
Okay. Lacey had another question. Do you call the whole herd or just the positive animal? And do you totally stop breeding? And do you call any offspring born from a positive animal?
That's going to be a question to work through with your veterinarian because it really is going to depend on your farm goals, whether you're selling for breeding animals, whether you want to eliminate Johnes from your herd. I mean, culling the whole herd is drastic. Some people choose to go that route. Culling just positive animals is probably, if you're trying to go negative, that would be a minimum, would be to cull the positives. Offspring born from a positive animal, if that animal didn't have signs of Johnes disease at the time that offspring was born, there's about a 2% chance that it is going to be positive. It's going to be up to you whether that's an acceptable risk or not. In any case, if they were born from a positive animal, you're going to want to test frequently once they're over a year of age to catch them as soon as they become positive. Otherwise, they're going to contaminate your environment. So yeah, it really depends on your goal and your management system. If an animal is born to a positive animal, ideally you will take it from that animal within like hours of it being born and then feed colostrum from a negative ewe or a negative doe or replacement colostrum, and then feed pasteurized or replacement milk. So it doesn't get risk of exposure from the colostrum, the milk, or manure around the dam.
Okay. And Lacey had another question. When you say 3 annual years, is it better to go by blood or fecal testing for the results?
If you're testing the whole herd or flock, and especially if you have a a large enough flock that is a meaningful number. Either one, whatever is more feasible for you to collect. Often what dairy farms that are trying to go through a negative, they're trying to convert to negative, they'll do blood tests for the first few while they get down to 0 positives on blood tests, because the blood test is just easier to collect. And then they'll do a PCR, but sometimes that PCR is nasty because they'll find a lot of positives that they missed with the blood test. So fecal testing is probably slightly better, but again, it's a pain in the ass.
And Sandy had a question. I have seen on the ag site that Johnes is a notifiable disease. What does this mean?
At the moment, it doesn't mean a whole lot. It means that whenever I get a positive for Johnes disease, I report to the chief veterinary officer. It means that she has the authority to use that information to control disease and monitor its incidence. Right now, we don't have a Johnes disease control plan. So we kind of just report it and nothing is really done with that information. It's a bit different between reportable diseases. Reportable diseases, when I report, there is something done about a reportable disease. Notifiable diseases are ones we're just sort of keeping an eye on. She does have some power under that act with a notifiable disease to impose movement controls, that kind of thing. But it's a little more limited with a reportable disease. Okay. So she will be informed of any positive. She doesn't really do anything with that information right now. And I think as a province, hopefully we're going to start looking at, maybe we need some, not like a regulatory, like hard hammer approach, but maybe we need to start, is incidence going up? Do we need to start putting some, subsidized testing or something in place to help with Johnes disease?
Okay, thank you. And Clarissa had another question. If you suspect an animal has it, have tested, gotten negative results, but don't know why else she would be showing the signs she has, would you suggest calling?
If they have signs, the tests are pretty reliable, so I would worry that there's something else going on. It really depends on the signs, and it depends on her quality of life. If her quality of life isn't adequate, then obviously you should euthanize the animal. I would suggest sending her in for a postmortem exam, because then we'll figure out, okay, maybe she's got lymphoma in her intestine. That will be virtually indistinguishable from Johnes disease. And I'll just give you that peace of mind. Or if it is Johnes disease, then you'll know. If you have a positive herd, I'd be more inclined to cull. But if all the rest of your animals are negative, it's less likely to be Johnes disease, more likely to be something else.
Okay. And Jaya had a question. Which test is considered superior for screening? I think we've kind of gone over this, but I think, that's kind of a good thing to readdress.
It really depends on who you talk to. They both have advantages and disadvantages. So in an animal that has clinical disease, the fecal PCR is clearly superior. Okay. In animals that are young, or you're just doing a full screen, doing both is the best if you want to give your best chance of finding it. But if you're just doing one of them, either one, it's 50-50. Just depends whether you prefer collecting blood or you prefer collecting poop.
Okay, super. And Angie had a question. Could you please address showing animals from a positive herd flock?
Whether you're allowed to?
Yeah.
You are, well, it depends on the show. Different shows will have different regulations, and so it'll be up to the show if they don't want to have a positive animal in their show. If you are taking animals to a show, you kind of have to assume that someone else in the show might have Johnes disease and protect your animal from that. So try and minimize their contact with the feces from another animal, be that putting on shoe covers and not having your food right next to where the other animals are pooping. So it is up to the show whether or not that's allowed. Whether or not that's ethical is sort of a personal decision. Oh, this damn light. Is a personal decision. And if you go to a show, act as though other animals there are Johnes positive, just to be safe.
Okay. And Andrea had a question. Suggested cleaning products for food, dishes, troughs, water buckets, i.e. for poop contamination from stacking feed dishes, etc. Bleach, dish soap?
Yeah, so no disinfectant is going to work to kill the bacteria if there's any organic matter present. So by far the best defense is soap and a good scrub to get rid of any organic matter. Bleach doesn't do a terrible job, so soaking it in bleach for 10 minutes is definitely won't hurt. Work on any of the peroxide cleaners. But the real key thing is you have to get rid of that organic matter, or the bacteria is just going to hide out inside, biofilm or organic matter. So you're going to get rid of 99.9% of it that you're going to get rid of with just dish soap and a good scrub and making sure that that's completely clean. And then if you want to soak it in bleach, that's going to help, but it's the cleaning, that getting rid of the organic matter that's really important.
And Sandy had a question. Dr. Collins says that because they are shedding more in stress times, he is a lead.
Oh, that's probably for if it's better to test at times of stress.
Mm-hmm.
Sure. I mean, it does, like collecting samples if an animal's already under stress, you want to collect a blood sample too. So it will depend on your system. I haven't seen any research that shows a significantly higher rate of detection under stress, but certainly could be possible.
Okay. And Marie had a question. How many years after closing a herd, e.g. good biosecurity and no new animals coming in, would you be able to decrease the frequency of your herd screening, e.g. instead of testing annually, extend the time span further between tests?
That's probably a question to go through with your veterinarian. To be part of the Johnes free protocol in Australia, you have to test annually for basically ever, because there is always a risk of it coming in, different, deer wandering through. There is always, it's really common. Like it's in human drinking water, they can find it. So it is really, really common. So it's going to be up to your risk tolerance. Do you want to, testing annually is gold standard? It is likely not to be financially feasible. So it's up to you to come up with that balance. Am I willing to accept the, albeit quite low risk? And how low that risk is going to be is going to depend. Are you near a dairy farm? Are you near another farm that has positive animals? Do you have a lot of deer wandering through? Do you have a lot of rabbits? Do you have a lot of hares? So that's something your vet can sort of work through with you. What is your risk of having it introduced, even though you have a really closed herd? And how does that risk benefit analysis? Like, is it worth testing? And also, if you're trying to sell breeding animals, what are the people buying those animals, what are they demanding? Like if they're demanding annual testing, you might have to do annual testing if you want to sell those animals. So that's really going to be an individual decision.
Okay, thank you. And Loretta had a question. How old before an exposed kid becomes contagious but is currently too young to be tested?
Once they're contagious when they shed feces. And as soon as they start shedding bacteria in their feces, and as soon as they start shedding bacteria in their feces, they will test positive on the fecal test. There's some like gray zone there where they can shed feces one day, not the other day, in this poop pellet, not in that poop pellet. But that they're not shedding it significant. Once they shed significant amounts of bacteria, like enough bacteria to cause a problem, they will test positive on our fecal PCR typically.
Okay. And Jai had a question. And fecal samples for the PCR be frozen before they are sent to the lab, or refrigerated for several days if collected on a weekend?
I would prefer them frozen than just refrigerated for several days. Refrigerated for several days is probably fine, but we don't really know the effect of some molds on our PCR. But frozen, absolutely fine.
Okay, perfect. That's good to know. Lacey, if you have a positive in your herd after you have called that animal, how long should you wait before you retest? I'm assuming the rest of the herd.
If you have if you have a positive and you've culled it, you know that it's in your herd. If you've tested your whole herd and you've picked up that one positive, there's probably not a lot of point in testing for another 6 months, because the ones who have come up negative are unlikely to change to a positive, the next day or anything like that. So if you get a positive on necropsy and you haven't tested the rest of the herd, that is a great time to test everybody and see who else is positive. If you pick up a positive on a whole herd screen, then I'd wait 6 months, cull the positives, wait 6 months, see if anyone else is converted to a positive. There's not a ton of point in testing more frequently than that.
And then I would assume you would continue to test annually if you've had a positive, if you
Yeah.
wanted to try and eradicate and work with your veterinarian, of course. Okay. We have one from Victoria. How sensitive are the fecal PCR tests in regards to cross-contamination? Could you get a false positive by accidentally touching a positive sample, then packing up with a negative sample?
They're actually pretty sensitive, so you definitely could. That's one of the blessings and curses of PCR, is if there's two bacteria there, it will find it and it will amplify it. So they are quite prone to cross-contamination. And that's something we're very careful with in the lab. But yeah, if you're using the same glove to collect feces from multiple animals, that is a possibility for sure.
So that would be a protocol if you're collecting feces, where a different glove for each animal, of course.
Yeah, or Ziploc turned inside out if you've got them somewhere.
Okay, I think we've come to the end of the questions. That was quite fast and furious there. That was 25 questions in 21 minutes. So thank you very much, Glenna. All right, we've got a lot of thank yous. I don't see any new questions. So thank you everyone for joining us on this fantastic information session with Dr. Glenna McGregor. We're very fortunate to have her take the time to be with us tonight and share her vast wealth of knowledge. So thank you so much, Glenna. It's been fantastic and I've learned a lot.
Well, thank all of you for coming. And if you do have questions, either call the lab or talk to your veterinarian. Johnes is really, really complicated. Don't try and tackle it on your own. It's really complicated, especially with the challenges of testing. So thanks for coming.
All right. Well, we'll hopefully see everyone again on another webinar. And good night, and everybody have a good evening.